Hello, my name is Steve Henry, and I'm a reconstructive plastic surgeon and a hand surgeon. Well, I always knew I wanted to be a surgeon. Even as a little kid, I was fascinated with anatomy diagrams. I grew up in a small town. I didn't have much exposure to anything except for small town medicine. And so it wasn't until medical school when I really, saw all the specialties and found what was my calling. I love to work on intricate things, and so hand surgery fit perfectly with that, as did microsurgery, where we sew small blood vessels under the microscope. So using fine instruments and manipulating small objects, it's right up my alley. We have a great team with a lot of talented surgeons and great nurses and PAs, and our practice focuses on complicated reconstructions, and you have to have a robust and competent team to take care of those kind of problems. And so I think that sets us apart. Nowhere else in town will you have this many people at every level of the organization with the expertise and experience that we have. It's a matter of not being in a hurry and taking the time to listen to the patient and give them enough time to completely tell their story before I start talking or trying to interpret what they're going to say. So you have to slow down a little bit, especially for the complicated problems. Oh, my job is awesome. It's rewarding from a technical standpoint, but also just from the interpersonal standpoint to see patients with a difficult problem and to see them through that. In my specialty, you get to know patients pretty well because we follow them for a long time and frequently. And so you develop relationships with them, and to see them recover and do well from their condition and get back to their regular life, that's why I went into this field. I'm an avid athlete, so I love to work out, and I recently got into competitive rowing. And I'm also very involved with my kids' sports, so youth sports occupy most of my weekends.